really common question that I get is, can I have sex if I'm using topical vaginal estrogen? Topical vaginal estrogen, such as Vagifem, in the vaginal cavity typically dissolve within a few minutes after insertion. The best time to use Vagifem is to use it just before you go to bed. When you start treatment, you'll be asked to use it every day for 2 weeks, so that's known as a loading dose, and then reduced down to the bare minimum, which is twice weekly. And now we recommend it lifelong because it prevents the symptoms from coming on and also the symptoms from getting worse as well. Sometimes some patients need it more than just twice weekly. They might need it 3 or 4 or 5 times weekly, and you'd always need to have a discussion with your healthcare professionals to know how much you're allowed to have based on your symptoms and also your atrophy changes as well. Using topical vaginal estrogen such as Vagifem shouldn't interfere with sex. When having sex play solo or with a partner, use a vaginal lubricant such as Yes Organic or Sutil, then go and pass urine, wash your hands, and you can insert the vaginal estrogen pessary after you've had sex. So that's the way around I would do it. But say that you've just inserted your pessary and now you are feeling quite sexy and you want a bit of sexy time with yourself or your partner. It is still safe to have sex even if you've just inserted your topical vaginal estrogen, as there's little effect of topical vaginal estrogen on the unprotected penile tissue or your fingers. Oral play, we actually have no studies on this in relation to inserted topical vaginal estrogen, but we think that there is still little systemic uptake. This study is worth looking at. It's a randomized controlled trial looking at absorption of vaginal estrogen cream during sexual intercourse with male partners who are having unprotected sex. It shows there was a mild level of estrogen that was elevated in men who were repeatedly having unprotected sex with topical vaginal estrogen inserted in the vagina. As a doctor, I take a pragmatic approach. Intimacy, love, care, consensual sex, and as women, our own pleasure is vital for well-being. We should capture those moments when they come. So you can have sex and topical vaginal estrogen. It actually makes it really comfortable. I hope that's helpful. As always, leave your comments below.